Hello, my name is Haiming Dong from the Ballard High School Biotech Academy. I and my partner Kai Van Hoy's purpose is to make a video about the Zika virus that has recently resurfaced in northern Brazil. Our goal is to inform people the truth about the Zika scare and how the Zika virus can affect you. Hopefully, our video can educate people on how to prevent contraction and the potential dangers of the Zika virus.
Recently, there have been a drastic increase in babies born with mutations, specifically microcephaly, in tropical areas. These areas are known to house the Zika virus, which has led to scientists at the Center for Disease Control and Prevention convinced of the relationship of mutated births and the Zika virus. Now we are sure of the relation. As of the last 10 years, the Zika virus has had a breakout, and there have been numerous reports of women who were exposed to the Zika virus giving birth to damaged or disfigured babies. The Zika scares all over news reports, but we are here to explain exactly what happens in the womb and whether you should be worried about the Zika virus affecting you. The Zika virus is a sexually transmitted disease and can also be spread through infected mosquito bites. To avoid contact with the Zika virus, use a condom, avoid anal or oral sex, avoid blood transfusions, and most importantly, avoid infected areas in Africa and South America. The Zika virus itself is not that deadly and can be compared to the flu. The symptoms only last for a week, but can reoccur. Although the Zika virus only stays in the patient's blood for no longer than a week, if you are pregnant while having the Zika virus, then you have a significant risk of your child having microcephaly or having paralysis when born. This is caused by a transfusion of your blood and your baby's. The Zika virus itself is rarely fatal to grown adults, but because your fetus is not fully developed yet, the Zika virus becomes toxic to the child, damaging it, if not killing it.
Microcephaly is a birth defect where a baby's head is smaller than normal babies of the same gender and age. Smaller head also means that they will often have smaller brains that is not developed properly. Improper growth of brain can happen during pregnancy, and it may stop after birth, which results in a small head size. It can be the only major birth defect, or it can happen with combination of other defects. Microcephaly causes the baby to have seizures, problems with speech, walking, sitting, standing, problems with balance, vision problems, hearing loss, and difficulty eating and swallowing. Microcephaly is not common. Chances of a baby born with this disease are 12 in 10,000 in the United States. Microcephaly can be diagnosed during pregnancy or after birth.
When Hartley from Kansas had a child named Claire born with microcephaly. Her child had other medical problems including dwarfism, spastic cerebral palsy, epilepsy, scoliosis, and cortical visual impairment. There was no family history of the defect. Even after genetic tests nearly 15 years later, the Hartleys still did not have any explanation for how Claire developed microcephaly. The Hartleys already had a healthy boy named Cal, but they were given a 25% chance that their next child would have microcephaly. Another scan a month later confirmed the news that they had dreaded. They found out their second daughter, Lola, was also microcephalic. Lola shared many of her sister's medical problems. Though unlike Claire, she does not need a feeding tube to eat, her seizures are shorter but more frequent, and by the age of 9, she weighed only 12 pounds but was 2 feet tall. Claire is below 3 feet. Gwen Hartley now remarks that she was exposed to the Zika virus before the pregnancies, and we now believe this is the cause of the mutations.
Overall, you're not at risk of contracting the Zika virus and have even less of a chance of having a baby born with microcephaly. Still, there is no harm in getting tested for the Zika virus. Thank you for watching this video.